Hello, everyone, and welcome to the Flint Community Webinar, your community resource. We've had a whole total solar eclipse since we saw you last, so it's really good to be with you and bring you some expertise. So excited to bring our wonderful experts that we have with us today. So we've got Anthony Nicholas talking to us a little bit about DEA Take Back Day, really important day in the community, but he's also going to talk to us about some really important news fresh off the presses, some really important great data. We've got Nurse T with us today again to talk about National Minority Health Awareness, and then Flint Speak for Yourself with Black Leaders. Sharia Ayers is here with us today. So we're going to go ahead. I'm so excited to bring you here with us. All right. And I think, Anthony, you were going to talk to us a little bit about DEA Take Back Day first before we got into your observational study that's fresh off the presses.
Yes. So thank you all for the opportunity to speak about this. And I apologize for the pivot, but I felt like it was much more pertinent information. So our coalition hosts DEA Drug Take Back Days twice a year. So part of the spring cleaning this year is cleaning out those medicine cabinets on Saturday, April 27th. We'll be joined with community partners at the Burton Police Department from 10 a.m. to 2 p.m. This will be the only day this month that we'll be able to take in prescription pills, needles, patches, liquid medication, fentanyl test strips, and naloxone will be delivered, available, as well as training and distribution for a lot of the community members. I will attach the flyer for it as well in the chat.
Thank you. And this is such an important resource, something so important for us to be aware of, because I get questions in my office all the time about what do I do with my old prescriptions, right? These prescriptions have expired and I want to dispose of them appropriately. So I appreciate this resource being in the community.
Yeah, we have 10 drop boxes across the county. We have them stationed at local police departments. So it really works out. We just rotate through across the county to be able to meet the community at their needs and be able to be accessible. First, one, let them know about the drop boxes and that they're available, but two, for additional resources and information, and then naloxone distribution and training to keep them aware about everything as well. So these are great events. We do them once in April every year and then October every year. So please join us. The flyer is in the chat for everyone. And would you like me to move forward with the rest of everything else?
I was just going to say one last thing that it's important in part because of alluding to a little bit of what you're about to get into next, that we think about how we're disposing of these meds because people can get into them that we don't otherwise want getting into them, right?
So, yeah, absolutely. And I think it's so prevalent too, with even when we get into this discussion surrounding marijuana, how even more accessible that has become both at the home and in the community. So there's a lot of different pieces to the puzzle, and we're just trying to figure out all the ways that we can help with bringing in projects, implementation, and different access and resources to those as well. So very excited.
All right, get into the super cool observational data that we're going to learn from. I appreciate it.
No problem. Let me go ahead and share my screen.
So this is our expertise on the webinar, right? We love to be able to bring the community like fresh new data that we're learning about in the community that's done sort of in partnership. So I want to thank you for all the work you do in this space.
Of course, this is, when I say hot off the presses, we're talking hot off the presses. This is smoking hot, and we've been doing this since last year, but really this was a great opportunity for us to get a sense of what the environment has been like since the legalization of adult marijuana or adult use marijuana in the state, and how that has impacted Genesee County. So the presentation, the report that will follow, is titled Welcome to the Stone Zone. This is an environmental scan and observational study of marijuana retailers in Genesee County. So a little bit about our coalition. We are our diverse work group of community partners, stakeholders, organizations that all come up with ways to develop new and effective ways to prevent and reduce mental health and substance use disorders. So I've attached both our vision and mission statement here. I closely aligned with both of these because when I was thinking about the process for doing this observational study, I'm like, okay, so thinking about a healthy and thriving community, what is an innovative strategy? And this observational study just became really a multitude of both of those components. And I have to give credit where credit is due. This is in really great partnership with our marijuana work group, who are always with us month after month, looking at some of these data pieces and all the results and trying to find new solutions. But also this was in a collaborative partnership with Oakland University. We had one MPH student with us that was doing this as part of her practicum experience. So this was a great experience for both her and I to collaborate on a lot of these pieces and to share with her different communities to work with. So let's get a look about some of the local data. Now, some of you may be familiar with the MiCHWA survey. This is a behavioral health risk factor survey that is conducted in the state of Michigan, but it can boil it down to specific counties. We use this information as a baseline data. So we're looking at a few pieces for these as baseline data for our interventions to see if if we're moving the needle, but how effective we're being at all with it as well. So one key piece that we looked at was marijuana use past 30 days of Genesee County students that were surveyed. So you can see that the survey is for 7th, 9th, and 11th grade students. And in 2022, 24.9% of students said that they have used marijuana in the past 30 days. Now, comparatively to the state of Michigan, you can see the 30-day use is the red bar. In 2017, which was the last piece of data that we could find on it, that was at 23.7. Now, conversely, you see in the state of Michigan, or in the 30-day national use, kind of relatively ebb and flow, but the perceived great risk, did the youth think that this was a great risk or of harm to them? From 2007 to 2018, it dropped almost by half. And so we wanted to see, obviously, with the perceived great risk, when that drops, 30 days use goes up. And when we looked at the MiCHWA data, that's exactly what it showed us. So there's two pieces of information here as well. So difficulty to obtain, marijuana became the easiest comparatively to alcohol and cigarettes from 2018 to 2022. It became the easiest to obtain. In perception of risk, that dropped considerably comparatively both to alcohol, cigarettes, and prescription drugs that remained above 60%. Marijuana dropped to a staggering 28.4% in 2022. Now, like I just mentioned, when the perception of risk drops, the 30-day usage ultimately inversely increases. So those are some of the things that we wanted to look out for. But the difficulty to obtain, that became easier. So that was something that we wanted to look at as well. Now, the quantitative information helps us establish a baseline, understand how effective are our measures at, but we needed the qualitative data. We need to understand some of the local conditions that were happening in Genesee County and the perceptions behind people and what they thought. So during the same time period, we conducted a community readiness survey. That is a brief survey that we interview stakeholders to assess the community's readiness to act towards change. One of the participants that were utilized in the survey was a youth, and he sees in the first quote above, you could see that he's joking with his dad, saying that marijuana retailers are almost becoming as prevalent as liquor stores, churches, and Dollar Generals. So they're becoming, in the past couple of years, becoming just as prevalent as these local establishments that we see frequently within the county. And as some of you may know or remember, in April of 2022, a 6-year-old student in Clio brought their parents edibles to the school, passing them out to students because they thought they were candy. They looked like in a lifesaver package. So more than a dozen students consumed the 30-milligram gummies. 5 of them were admitted to the hospital with symptoms of feeling ill, nausea, and lethargy. And lastly, a member of our marijuana and vaping work group informed us that THC vapes were being resold to minors near the school, creating a secondary market for youth to access. So Just like we mentioned in the previous slides, this secondary access to being so prevalent in the community, the proximity to different places, they're always being accessed in the community for youth. Now, from there, looking at our local data, I needed to find something on a national scale to begin this process of an observational study. So California and Colorado were the two states prior to Michigan that were able to, that put the legislature for adult use recreational marijuana. From there, I found two studies that kind of closely aligned or were similar to what we were looking for. So one of which stated the geographical availability of retailers and dispensaries, advertising, marketing promotions, and billboards can influence youth to use marijuana. Studies that showed from the 13 to 17 years old who were regularly exposed to billboards, storefronts, and advertisements had an influence on youth using that drug. Now, also, living in with 1 kilometer of a retailer had a strong association with both past year and monthly use, as well as a high perceived access to cannabis. Just like I mentioned in the MiCHWA, the difficulty to obtain dropped, the perception of risk dropped, and the 30-day usage ultimately as an inverse relation to it increased. So those were comparatively what we were looking at. Now, we had to map out those retailers. So this is a geographical information system of the marijuana retailers that we surveyed last summer in Genesee County. So we found that there were 27 retailers across 6 different municipalities. To find those retailers, I had to use weed maps. I had to figure out what the people use to find marijuana or find a dispensary or order any of marijuana in their community. They utilize weed maps more commonly. So that's how I was able to figure out where all the prices, all the distribution, all the retailers, everywhere that they were located. That, I mean, I'm telling you, Weed Maps is a very in-depth app, and I understand why people use it so frequently. But that being said, aside from that, our survey conducted 27 retailers, and we utilized a geographical information system through the health department. And that will be more important later of why we use a GIS system. So let's start looking at outlet density comparatively for all these different counties or all these different townships, municipalities, or villages that had retailers. So we could see City of Burton right away, 29,499 residents, and now they have more than 10 retailers. 1 retailer for every 2,949 residents. City of Flint, 1 retailer for every 13,000. But one that stood out to me the most was Thetford Township, a very rural town. They have 6 retailers for a population of 6,528 people. That's 1 retailer for every 1,000 people. So these are some of the things that if you don't look at all these things from a higher view lens or a public health lens, you can see that they just explode in the environment. Now, to get an idea of how to grade retailers or look at retailers more so than just observation, I needed to understand how they were able to operate within their communities. So then I had to go look at the municipality ordinances. So this is the key component that you can find regarding all businesses in a community. But marijuana is a new topic. It's a new piece of the puzzle in ordinances to a community. So I had to look at 2 components. You see the zoning districts in the top box and then the operational limitations. The zoning districts and the zoning requirements pertain to where a business can operate and the requirements of, or essentially the proximity that those buildings can operate within comparatively to other places in the community, most commonly to protect the public health. So you'll see in zoning requirements that the building has to, a marijuana retailer has to be within a certain distance away from a school, a church, a municipality, public park, so on and so forth. There's some people include them, some ordinances include them, some do not. They have their own way of incorporating those measures into there. Then the operational limitations include how the business can operate. So you'll see hours of operation, who's allowed to be on site under the age of what age, advertising, marketing. These are the things that you are commonly seeing within the operational limitations. Those two components provided us a rubric, essentially a way for scoring retailers across the community. We knew through the GIS map and the locations, we wanted to see the general proximity to public places with the ordinances attached to it. Okay, so what we're trying to really see in terms of compliance, where they're at in a location. Now, we're looking for risk factors essentially within each community. How are they appealing to youth? What kind of deals are they marketing? Are we looking at different tactics that are being displayed? Can you see through the windows and through the doors of these establishments? Can you see products visible behind the doors of the entrance? Did they have paraphernalia displayed? And then we're looking for more things in terms of compliance. Do they have a security system in place? Are the windows and doors completely opaque? Can you not see into them? And did they have any additional signage as protective measures? 21 to enter, 21 to buy, 18 with the medical marijuana license. So those were some of the key components that we had looked for each location throughout each municipality. Now we'll go to some of the observational findings. So this is the city of Burton. City of Burton, reminding everyone, has 10 retailers. So we'll go through briefly some pieces. Now, Joyology looks like, to me, not one of a marijuana retailer. It doesn't really market that it has marijuana available, which is one thing, but it has a very appealing to youth nature to it. It looks like a bubble tea spot. It looks like you would go to get frozen yogurt at. It looks like it's just really almost like a candy store with the windows and the different tiles and the bubbles and everything like that. Inspire is a new location in Burton, and well, newish, I should say, as last summer. You could see that the windows are completely open. You could see all the marketing behind the windows. And actually the two staffs leading up the stairs is really fake marijuana plants. So it's really just marketing to community that they have it widely available here. And lastly, we got Light Sky Farms in the center right there on the bottom. They have a big painted mural right off Bristol Road, looking seemingly like the cultivation of marijuana. It doesn't have a marijuana plant displayed, but we know that they are a grower at this location as well as a business. So they have the growth of marijuana all the way up to someone smelling it there, as you see. City of Flint. So this GIS map overlaid all the different zoning districts. So that's why it was so important for us to understand if they were in the correct zoning district. You could see these two little blue dots, one in the bottom left corner and one in the almost the top right corner. One's in a neighborhood center and one's in a traditional neighborhood. This is right across the street from the General Motors plant. So these are essentially in neighborhoods, so to speak. So you have two retailers in neighborhoods in a very populated and busy area. The Sozo in the top right corner, they have a big graffiti mural that you've probably seen. It's almost right across the street from the University of Michigan. But this window that I noticed across from the side, you can easily see into it and look at all the products. Since then, they have now put bars over the top of it, but you can still easily see into there and see that there's products available for purchase. Skyman, our poster child right here. This is our poster child. This is the representation that we send to the community. Welcome to the Stone Zone by Skymint was one of the ones that I took away from this, was just like, how is this allowed to happen? You can see through the behind the front doors, you have the Welcome to the Stone Zone display banner, but you also have a actual poster on the left-hand side next to the door that makes it more prevalent as well. So really that's giving off the idea of these are the effects when you come here. This is the idea that you get when you're in here. This is the opportunity to get those things. You want to get stoned, you go to the Stone Zone. Now, comparatively looking at it from a public health standpoint, is there a place that says welcome to the drunk zone? You wouldn't see those things. This is why the marijuana businesses have been able to get away with all these things comparatively to alcohol or tobacco products. Next, we'll look at Thetford Township. This is important too, because you can see that there's the the signage right here for Loud Wellness in Green Light District has the Rave Cafe, Rave 420, but they're in a residential use. So they're in a parcel of property that is actually designated for residential use. Obviously making them out of compliance. This Easy Med sign, if we notice right in front, underneath it, right in front, you can see the children's crossing or children at play green figure with a flag. So they have this on both sides. And this is important because this has the appealing nature to youth. This is some of the things that, although it's not a marketing tactic, it kind of lightens that perception of risk being associated with it. And those are the things that we are constantly looking for from the public health perspective. So now that we gathered both the municipal ordinances and the observational findings, we were able to score each municipality. So this is what we see in the report that I'll share after this. You can see through all of the different municipal findings, and this is the retailers in the city of Flint. We took the 4 components of our rubric, including the environment in the zoning district, the proximity to the particular public health places that they were mentioned in the ordinances. And then we also looked at bars and liquor stores. For those that are adults that are over the age of 21, it is lowers that risk associated. I mean, the risk and inhibition of alcohol can maybe lure someone to maybe go get marijuana afterwards. So we then looked at the appealing to community minors and then the compliance, and we scored them. So you can see in the bottom left corner, there is a key for the potential risk factor to the community and or youth being a 0.5 point, and then a yellow being found to be non-compliant with state and local ordinances as 1 point. And then we scored each retailer within the municipality. We also looked at proximity to schools. We want to include demographic and socioeconomic data for each municipality as well. So you could see on the right-hand side, this map is a location of the 6 retailers that are within the city of Flint. We attached buffers looking at a 1/4 mile, a 1/2 mile, and 1 mile away from each of these retailers to see the proximity to local schools. So you can see that there was 5 retailers that had 1 school within a 1/4 mile radius. 4 schools are located within a 1/2 mile radius, and 3 schools are within a mile radius. Now, within a 1/4 mile is not that far of a distance. In the city of Flint, they have in their ordinances for 1,000 feet for a school. So they can be relatively close in proximity to a marijuana retailer without them actually knowing it. Once we went through each municipality and all the retailers and put them into our scoring system, we were able to look at the full score sheet and put this in parent to each retailer and then overlay them over the full map. We looked at different zip codes, we looked at different socioeconomic factors, and we found numerous right off the bat highlights that we wanted to showcase. So we could see our poster child, Skymint, and this is not a biased thing. This is not totally biased, but Skymint having the Welcome to the Stone Zone being one of the lowest scores that we see here. So a little bit about the socioeconomic impacts when we looked at all the different layers of disparities attached to them. So of the 9 zip codes that retailers operate within Genesee County, 6 have a higher unemployment rate, 6 have a lower median household income, and 6 have a lower median family income than comparatively to Genesee County overall. 7 of them have a greater percentage of those without health insurance coverage, and 6 have higher rates of families whose income in the past 12 months is below the poverty line compared to Genesee overall. So now we have an additional layer, how it's impacting the health, and we want to ultimately utilize this in a different fashion in the future as we continue to keep looking at this potential impact that it has. Now, just for context, I wanted to showcase some of the highest graded retailers. So these 3 retailers are actually in the city of Burton. We have Gage in the top right corner, who I actually met with the manager when I approached them and discussed it with him about who we are as a coalition, what we're doing in terms of our process. And he was very receptive to it. His building looks just like a regular storage facility, but there's key pieces that I want to point out. Adult use 21 and older. on two parts of the windows, facing the road, facing the sidewalk, public facing. The doors have the hours of operation. Every single window or door is covered, completely covered. We see at the barn in the lower left corner, they just have a simple sign on the front door saying no one under the age of 21 can enter. Bigfoot in the bottom left, on the bottom right corner, is now open for recreational sales, 21 and older. Same sign to the right of that as well, facing the street, has a 21 and older sign. Windows and doors completely blacked out. You cannot see through. Now, it is not required of these retailers to do this. They did it amongst themselves to protect the community. Now, that is something that I was like, wow, if these people can really do this out of, protection of the community, then why aren't the rest of our communities doing something similar of that? So now that we had some socioeconomic data, I wanted to kind of really boil down to the differences in the municipalities' zoning and ordinances. Now, I want to preface this by saying the CRA, which is the governing body of the marijuana distribution through Laura and through the state, only offers recommendations of how municipalities allow these businesses to operate within. They only say that they can have 1,000 feet of a pre-existing public or private school providing education in kindergarten or any grades 1 through 12, unless a municipality adopts an ordinance that reduces the distance requirement. So the six municipalities, we see that one of them only lowered that from 1,000 feet to 300 feet. The city of Davison, which is the newest one, didn't even include those in their ordinances. So they have no protections pertaining to how close in proximity there are schools, mainly because they have a lot of schools in the city of Davison nearby. But that being said, we wanted to look at the differences. You could see the differences between residential areas, other marijuana retailers, municipal parks, places of worship. If you see that there's a dotted line, that means they did not include this in their ordinances. If you see prohibited, that means that they are not allowed. So you can see when signage paraphernalia included, do they have any ordinances surrounding that? That is something that we'll look into in the next slide. Most of them had something prohibiting. They are not allowed to. Now, this is where the fun starts on the public health side. I looked at all of these, and this is the prohibited manner of advertising or marketing for marijuana establishments. They're all very similar. They're all very subjective. They all don't have anything. They just say, really, they can't appeal to youth. But what is appealing to youth? Without giving any of these retailers the opportunity to understand what nature of appeal to youth you are really wanting to state, then they could say anything. I remember I drove around Christmas time at Dort Highway Dispo, which is in Burton, and they had a display on their big cross on the side that said, treats that will make Santa jolly. So I don't know anyone that's over the age of 21, and I'm sorry if I'm bursting anyone's bubble that believes in Santa still, but anyone under, teenage years may still believe in Santa. So if you're putting it out there as the appealing nature to youth, you are constantly going to find that perception of risk drop, that 30-day use increase in terms of the youth. So these were some of the effective measures that we put in place as recommendations in our report. So I wanted to include this because this is such a key point, and I'll get to it at the conclusion of this is why this has been such an important piece. So we included ordinances as part of our recommendations. I looked at Colorado, I looked at California, I looked at other states, and I was just kind of like picking and choosing through different ordinances that they have publicly available and some protective measures. So some just general restrictions. You cannot use of cartoon characters, animated figures, bright colors, imagery appeal. You can't you have to have age restricted content. And also you have to have age restriction signage, just like we saw in some of the highest graded retailers in Genesee County. You need to have a door or a window that says 21 to enter, 21 to buy, just like you would do with alcohol. It's not hard. If people can do it just because they are doing it, then we should be able to put this in the ordinance as something that as a protective measure across Genesee County. Now let's get to the dollar bills, because this is the reason that communities and municipal governments and communities ultimately want to participate in allowing marijuana to be flourishing within their community. So when the appropriation, or when the Michigan Regulation and Tax Marijuana Act was initiated, there was a fund set aside. So 20 million of that fund from excess tax, which is 10%. So there's 6% sales tax and 10% excess tax for marijuana adult use products. When they're purchased, 20 million is allocated directly to the FDA after every single year. And funds are then divided between municipalities, school aid fund, and transportation fund. So you'll see last year, for example, 2023, there was 2 billion in sales from marijuana. 15% of that goes to the municipalities, so the local government. 15% goes to the county, and then 35% goes to K through 12 education, so Michigan Department of Education, and 35% go to the road and bridge repairs. So of those excess taxes that are set up through LARA, they then get redistributed back to the municipalities and back to the counties. So you can see through the growth in the top right corner, the tax sharing revenue. So that revenue that gets shared back to the municipalities, the local government. For each local government in 2022, they received 28,000. For each retailer they had in the municipality, they received $28,000. In 2021, $56,000, and in 2022, $51,000. Not updated yet, but in 2023 they received 59,000. Because they received over $2 billion in sales in the state of Michigan. On the left-hand side, you could see the marijuana revenues that were collected per each municipal government. Thetford Township, for just having 6 retailers during this time period in 2022, $51,000 for each retailer, $311,000. It's simple math. And you can see that there's a financial incentive looking at City of Burton, City of Flint, and Thetford Township to have retailers in their communities. And this is opening the door for more communities. We saw in Montrose, and actually on Monday and Wednesday of next week, the city of Fenton is having an open discussion regarding potentially allowing this to happen. So this is, you can see this constantly maybe spiraling and turning into the wild, wild west across Genesee County. Now, looking at the money and taking the full report, I want to be able to provide everyone with a copy of the full report, so I'll drop that in the chat. Please, it's a lengthy report, but we put blood, sweat, and tears into that bad boy, and it's very exciting. I think we have a lot of great information, but I want to use that report as a leap into envisioning a healthy and thriving community. So when we received those full reports, and we broke it down into the individual municipality reports. So the 6 individual reports as well as the full reports encasing all of the results. They were developed and distributed to prominent local stakeholders across the county. So school superintendents, that local city council members and planning commissions, county commissioners, and school resource officers all received a copy, or an individual copy, depending on where they resided or oversee. We've been bringing awareness to city council meetings and to municipalities that have previously opted out and are considering opting in. I just mentioned the city of Fenton, but I was at the city council meeting in January. They currently have 11 retailers. I know this survey said 10, but they have 11 retailers, and they were asking the community's impact or response for 12 retailers in the city of Burton. And we brought this report forth on that city council meeting, and we ultimately overturned that decision to just keep it at 11. Then we have been assisting local governments with the planning process. I actually had the planning manager, planning commission member, Kevin Lawrence from Thetford Township, call and said that the report was very, very, very insightful, and they were looking for ways to maybe utilize some of this information in terms of redeveloping their master plan that they're going to do this year. So looking at that. So perfect how we can assist them from a public health viewpoint to be able to get that into priority. We're in also some preliminary discussions with the Genesee County Health Department. We can see that there's proximity to local retailers and the abundance of products in the community. We want to be able to distribute safe storage bags. If you're unfamiliar with some of the legislature, a person can have up to 2.5 ounces uncovered in their household anything over 2.5 ounces has to be covered. They can also grow 12 plants in their house. So we want to be able to provide safe storage boxes, looking at that Clio as a experience to shape the future. Potential partnerships, of course, with local retailers and provisioning centers. Why would we never want to incorporate them in our work? I feel like that their insight and their understanding the community from their viewpoint will ultimately help us in our viewpoints. And working with them on providing them with the information and resources, providing with the safe storage boxes, letting them know that, hey, we're not here to take you off the streets, and we're not here to, shut down big cannabis. We're here to help and do this in a responsible and safe manner. And lastly, for the last 6 months, I've been helping other coalitions across the state follow similar suit to conduct environmental scans. And then continuing this environmental scan process in this summer and the following summers to continue this process to see what more data will ultimately show for us in the future. So I know I had to burn through that. I'm so sorry. I had
No, this was
no time.
amazing.
Yeah.
First of all, I appreciate you being willing to talk about this new data. Second of all, it was amazing. Really important information. I want to get to a couple questions that came in through the Q&A, and I want to be respectful of Nurse T's time because I know she's got some important information too. But what I thought was really valuable was that not only you told us about the impact that this has potential to have, but what we're doing to partner with the community to respond. One of the questions we have in the chat is there any information provided on the harmful effects on the brain for younger people? It seems nationally that sharing that information is not a priority, and people who don't read research articles don't understand the risks. And I think it gets that at the idea of we've sort of de-incentivized the scariness around potential use, right? We've sort of said, we've got bright lights, friendly looking places. I keep seeing these places pop up and they look like nice places to be. Honestly, it looks like some of them look like spas. Like, I don't know if you've seen even others outside of Flint, but it's just, they are enticing. And I wonder what we're doing to combat that marketing with education. And I think that's Dale Miller's question.
Yeah, I think there's so much conflicting data, and we've gone back and forth with this with our marijuana work groups, and it's very difficult. So there is information that is provided on the harmful effects of the brain for younger people. We've been utilizing the One Choice campaign. They have a great series of information that they utilize to kind of get that message regarding the harmful effects. And I'll put a plug for that in the chat, but we've been utilizing that. We partner with Dr. Brittany Taylor, who's done a great job with the harmful effects in terms of her personal experiences. And then the smart approaches to marijuana has been a good state resources that we've been utilizing as well for this. But there's a lot of conflicting information out there. We've been seeing it in terms of people that are pregnant, in terms of curing medical sicknesses, health. So there's a lot of different conflicting information. I feel like we're always punching upwards towards it. So
I think that's a great context to give. And I think we want to remove stigma for people who might engage, but we also want to protect our youth. And so I think that's the focus that we bring this education with, right? Is we have growing brains, growing people, and we want to be thoughtful about what our potential exposures are. And if we can educate that, we might get a win there. Hey, Anthony, super appreciate this. Really great, timely data. Thank you so much. Please tell me you'll come back again.
Absolutely. Thank you. Anytime.
Awesome. All right. We're going to pivot a little bit, not that much because we're still talking about our health. So big shout out to Nurse T and Dr. Gordon for coming to tell us a little bit about National Minority Health Month. Thank you so much.
Are we up? Can you guys hear us and see us?
You are. We can hear you. I feel like we need a drum roll.
So we wanted to come on today. We put together a little bit of presentation. We wanted to just have a conversation. Our theme is always a healthy good time. So I'm Tarnisa Martin, and this is
Dr. Latressa Gordon.
Yeah, I'm the patient resource and community advocate for Hurley Medical Center. Also, I'm the assistant director of Michigan, wait a minute, the
Michigan.
Assistant Director of Public Health Nursing for Michigan United.
And I'm the Director of the Public Health Nursing and Navigator Program for Michigan United as well.
So,
Pleasure to be here.
yes, we're happy to be here.
Next slide. Okay. April is National Health Minority Month. The annual observance builds awareness of health disparities that increase among racial and ethnic minorities population in America, Indian, Alaska, Native communities, and encourage everyone to take action and end these inequalities. Next slide, please.
So what I wanted to talk about, just for a conversation, and I'm sure a lot of people was familiar with the sitcom Good Times. When we look at Good Times kind of portrays some of our social issues that our families and our communities experience today. It also shows us why it's still important for us to advocate for strong families, strong communities, strong cultures. And then the theme of the National Minority Health Awareness Month, it just lined up with this. So that's why I decided to put the sitcom Good Times. It was a spinoff of a fellow classic sitcom, Maude. Good Times follows an African-American family struggling to survive the hardships of living in the Chicago projects in the 1970s. So if you look at a lot of our minority communities and populations, they're struggling. They're struggling just to survive. And a lot of times we want to give them resources and they need resources. And sometimes it's hard to thrive when your mindset or when your day-to-day is always in a survival mode. Next slide, please. But when you look at the Good Times family, one thing that's displayed is you see a father, a mother, and 3 children. And if you look at this picture, and sometimes you may wonder, well, why would they call it Good Times if they were struggling? But when you look at the picture speaks volumes. You see a father and a mother. You see a husband and a wife. And you see the exchange and the love that's presented there. So you see the strength that's there in any situation of that struggle. And also you see children that's in tune. I think a lot of times when we look at our struggles today and we wonder why some of our struggles are different than the struggles of some of those in the past, it's because of that family foundation. Next slide. The impacts of Good Times. It extends beyond the portrayal of social issues to overcome poverty living and public housing in Chicago. What we see is a dad often worked at least 2 jobs. If we think about our community residents and we think about our community dads and we think about the minorities, sometimes they're at least working 1 to 2 jobs just to be able to survive. And some of the jobs that they're working may not even be high-paying jobs. It's much manual labor such as dishwasher, construction, labor, etc. And so often unemployed. And when we look at Good Times, here's a proud man who will not accept charity. So a lot of times too, when we try to give resources to our community, and sometimes we say, well, they don't want resources. It's because somewhere deep down inside, they still want to remain their dignity and they're proud. It's the way in how we distribute resources to them because they still have that mentality of being proud. I want to highlight this again. The impacts of Good Times extended beyond its portrayal of social issues. It showcased the strength of a family bonds, the importance of the community, and the ability to find hope in the midst of adversity. So when we think about this month, 2 of our goals should be the importance of community and the ability for all of us to come together and find hope for the community that we serve in the midst of our adversities. Next slide. I'm gonna turn over after this. Social issues of Good Times: evictions, gang welfare, mugging, rent parties. They used to do rent parties to come together and to raise money. That's just like how we do today with collaborating with others. Employment. We look at some of the social determinants of health: transportation, food, healthcare, education, justice system. And if you look at other things, depression, anxiety, fear, shame, and discrimination. Next slide.
Okay.
Yeah.
2024 theme. Next slide, please. Be the source for better health. Next slide. Okay. So improving health outcomes through culture, defined as all the ways of life, including art, beliefs, institutions of the population that are passed down from generation to generation. Communities, a group of people living in the same place or having particular characteristics in common. And connections, a relationship in which a person, thing, or idea are linked to associated with something else. I had a conversation with a community person, a member, and they said to me, it's also Black Maternal Health Week. And they said, we look at the hospital is to Black women is what the police is to Black men. And I had to sit back. So what they were saying is, our Black women are going into the hospital and are not receiving the same care and also not Black and brown are not receiving the same care as other counterparts or other people. So they're looking at the hospital as a place that's killing off Black women due to cultural incompetence, also systemic racism, the isms that occur within the healthcare system. So the question, when it said be the source of better outcomes, this is a challenge and it's a charge. How can we be that source? We have the data, we have the research, we have studies, years over years. So how can we take this information? We have it, now what? It's a charge to become better. When we have our new residents, when we have our new nurses, our healthcare, new community people coming in, it's not just a class that's presented. How can we actually take this information, translate it into action? So it's a call to action today, to be the source of better health outcomes. Next slide.
Go ahead.
Okay, the commitment, the Human Health Service Office of Minority Health, OMH, is committed to working with the public health and community-based partners to be the source for better health and providing quality, equitable, and respectful care and service that are responsive to diverse cultural health beliefs, practice, preferred languages, economic and environmental circumstances, and health literacy levels. That's a commitment that we should all make throughout the community. Next slide.
Health equity is advanced by two critical topics. So their whole focus and theme for 2024 is based upon these two topics. Next slide. Social determinants of health, cultural competence, and humility. And the one thing when we look at these, we are all familiar with them. And we are working together as community partners, influencers, leaders, providers. And although we're working for it, it's saying be the source. So what sources are we providing so that we can implement these social determinants of health and this cultural competence and humility? And then too, for some of us that may not be experiencing some of the historical traumas and some of these issues or social issues that our community residents are experiencing, are we operating in humility? Are we operating in respect? Are we assuming that we can just give them handouts and disrespect them because they're not proud? Like when we think about Mr. Evans, when we think about James, he was a good man. He was a good provider for his family. He loved his family. And in Florida, she did everything she could to take care of her family. But even though they did a lot of things, they still didn't have access to what they needed. They still experienced shame, depression, I remember some episodes when they went to the hospital, she couldn't even get service because she didn't have insurance. So when we think about that and we think about this month and we think about all of the cultures and the communities and the connections that we're building, as Dr. Gordon said, yes, it is a call to action. But the one thing I asked is just the humility. Where's our empathy? Are we able to look at it from our community residents' lens and say, okay, this is what we can do to help provide you services. We're not trying to give you handouts, but we want to do is put you in a position, and we are advocating for you to be in a position so that you can successfully take care of your family, and you don't have to feel depressed, anxious, fear, or disrespected because you're in that circumstance. Because we are aware that these social issues, they exist. They have been existing for a long, long time. But I think when we understand the historical traumas and some of the social issues and the reasons of the frustration of the community, and now that puts us in a place of humility, and we can become the source. Next slide. Next slide is thank you. We thank you for this opportunity and this time. And we just want to say that we don't own rights to good times, but we just wanted to use that as an ideal and a perception, a visual, so that it would be easy to relate to it. And sometimes one thing I want to close on is you saw that family smiling, right? But guess what? That family still has social issues. So just because you see somebody in the community smiling, it doesn't mean that just because they may not have a car or they may not have all of the resources that they need, that they are still not finding hope. So that concludes what I have to say.
Thank you so much, Nurse T. I thought, what a wonderful analogy. And I actually heard Good Times is coming back as a cartoon. So we'll see. Your analogy might be even more appropriate. We might have to bring it back and extend it a little bit as you talk about new issues. So thank you so much. Always really important, relevant information for our community to think about and for us to think about as providers who are caring for a community. So really appreciate all of that education. You too, Dr. G. Thank you, Nurse T and Dr. G. All right, Sharia Ayers, thank you so much for being with us today. We really appreciate it. I apologize because I give you less time than I told you we would, but appreciate you coming to talk to us a little bit about Flint Speak for Yourself with Black Leaders Detroit. So I'm gonna take it away.
All right, thank you. I'll try to be as quick as possible. And thanks for having me. So let me know when you all can see my screen.
It looks like it's loading. Yep, we can see it.
Awesome. So this year makes our 4th Ride for Equity. And if you are not familiar with Black Leaders Detroit, we are a funding vehicle for Black-led businesses and nonprofits that operate in the city. And we do that by everyday people who believe in fairness signing up to become donating members, right? So every member is not of African descent, but every member we have has a passion for equity. So with that, the membership dollars that come in through our donors, we put that towards no interest loans and grants for businesses and nonprofits of African descent. Thus far, in the past few years, because we'll be turning 5 in October, we've been able to help 375 plus businesses support or even be able to contribute to rather over 1,300 jobs. We've raised approximately or a little bit more than $450,000 in membership dollars, and we've been able to distribute with the help of additional philanthropic fundraising over $2.8 million in the hands of entrepreneurs of African descent. So with that, every year we do our annual fundraiser and as the Ride for Equity. And so the Ride for Equity is a 377-mile trek from Detroit to Mackinac City, right before the Mackinac Policy Conference. And we do this to kind of emulate the difficulty that it takes to ride your bike 377 miles is similar to the difficulty that African American entrepreneurs face in regards to accessing capital. So with that, we ride so that we can raise money and continue to do the things of building an economic ecosystem of equity and fairness. Now, this is pretty much the flyer for this year. So if you have seen it, this is us and this is what we are doing. So you can either come for the kickoff or you can choose a day to ride. I don't know how many riders we have, but even if you're not a rider, just come out, support when we're in your city. So with that, As I said before, we go from Detroit, taking on up to, well, we're going to go to Flint from Ferndale. So we go Detroit to Ferndale. That's the first small leg of the ride, and that's 6 miles. And then we go to from Ferndale to Flint, then from Flint to Saginaw. So this is over the course of 7 days. And in 3 of the 5 cities, I'm sorry, 3 of the 7 cities, excuse me, we will be hosting Speak for Yourself conversations, because again, we understand that what we do takes a village of people, and we can't achieve equity in isolation. So in those cities, we host community conversations called Speak for Yourself. And we will be hosting our first one in Flint for the 2nd year. And essentially, it's just an overall organic conversation around community, what it likes to be a good neighbor, as well as equity and what that looks like in your city. And not only that, this year we'll be hoping to see if there's a feel for building the same type of ecosystem in Flint, right? So we have some partners with Michigan State University. Heatherland is one of our partners in Connect, so shout out to Heatherland. But we will be at the MSU College of Human Medicine, again, by way of our partners, and one of our members, Arlen, helped with that as well. And then we have a few community members, like the Genesee County, I can't remember the name of the bike group, but Genesee County has a bike group and they are contributing. So it's been a lot of love and support from the Flint area in regards to amplifying our Speak for Yourself this year. So I'm definitely looking for people to show up and show out in Flint, so that, again, as we think about expanding and growing and showing that Michiganders are actually different, you know, in regards to exercising equity and what that looks like in our different areas. I'm just excited about this year. So anywho, if you are interested in attending, please register at the website that you see on the screen, which is bit.ly/BLD24SFY. So you can screenshot it, whatnot, or either I can have someone send it to you. Nonetheless, we will be in your city May 19th at 6 p.m. That's a Sunday at 6 p.m. to have a community conversation. We do plan on providing food. So again, don't be like some of my cousins and just show up and eat and not RSVP. So with that, but no, I mean, you can come if you don't eat, nonetheless. So with that, again, make sure you register to come, because I would love for you all to come out and just have that conversation. Because again, as we continue to build this ecosystem of equity, we need people to support. These are some of our
your sponsors. Yeah. I was just going to highlight how amazing an event this is. And for reference, this event, if you go back to the date and time, it's in our building, in the Flint Journal building, right? It's right across from the farmers market. So those of you who are unaware of where to show up, it's the Michigan State building, right in front of the farmers market that currently has some construction going on in the front of it. Shout out to Arlen. Arlen is MSU CHM's community outreach person in our Detroit campus. She reached out to us in Flint and was like, we've got more people involved. Really appreciate the community support here, right? Like, shout out to Heather Lynn for helping out with support.
Yes,
and hungry or not hungry, you should come on to our building on go to the date. Let's go back to the date one more time.
It's May 19th.
May 19th at 6 p.m. We'll all be hanging out to have a really wonderful discussion.
Yes, yes. So I am looking forward to what day one will bring. And with that, so these are some of our partners and sponsors that support what we do, as well as, well, this number has increased, as well as over 500 BLD members. And again, we have people from all over. So if you are not a member, I would implore you to sign up today at blackleadersdetroit.org. But again, we have people from all over the US, which is honestly amazing. that have signed up because they support the work that we're doing, and they have a passion, again, to see people thrive and understand what the implications of that look like. So
That's so fantastic.
yes. I don't know if we had time to show the video, but these are just some highlights of when we've been featured doing the ride. And like I said, I don't do the whole ride because I'm like the bike mama on the trip. So everybody's like, where's the bananas? Where's the sustenance? What are we doing here? What are we going to eat? So, however, if I did have the time, I would be out there too. But nonetheless, most of the people on staff will be in their bike shirts and getting out there on the trail. So with that, that's overall. Oh,
fantastic.
it's playing anyways. Sorry.
Oh, no
Yeah.
worries. Actually, we'll just put a link in the chat so people can catch the video. Thank
Okay.
you so much.
Yeah.
We appreciate you coming to talk about this. And I feel like I got to get on that Flint to Saginaw bike. So thank
I
you
feel
so
like
much.
you should too.
All right. A reminder about continuing education units for our community health workers. Shout out to Dr. G, shout out to Nurse T, shout out to Anthony, and all of the wonderful experts that we had here today. Have a great one.
Thank you.